Good morning, everybody. It's Wednesday, the 6th of May. Welcome to our daily COVID update meeting. And we're going to start by going directly to the board and taking a look at some of the latest numbers. The chart we're looking at here is the mortality rates for influenza and flu. And you'll see in 2018, we peaked at about 14,000. It was a mortality rate of 10.9 at its height. The flu season came and went and then came back in 2019, and we had about a 7.7% mortality rate. And then we came into 2019-20. This was back in February, and we were about 7.6% for the flu season this year. And then here in the bright orange with the yellow trim, this is the actual trend line for COVID. Started there in early March. You can see it immediately spiked. We hit a high back on April 11th at 24.8% mortality. And you can see this yellow line continues down to the week of April 25th, where the mortality rate had fallen to 14.6. So a really good graphic indicator that we had this very large spike, and we are now in a decline. The other graphs that we have been sharing have been more representative of the curve, and we talk about the flattening of the curve. But by looking at just the mortality rates, you can see a better representation of how COVID has spread across the country, and how, in fact, we have been able to slow the spread, and we're starting to yield results in terms of impacted residents and mortality. This next graph that I'd like to share is influenza-like illnesses, ILI, presenting at hospital for the first time. And you can see in week 16, this was not this week but last week, this is the situation, and green is on the low side, so most of Florida you can see is very low. The moderate range, we had several states in the moderate range. And then, of course, the corridor up in the East Coast that has always been up in the very high level. Compare this to what's happening in the week 17. You can see that we remained the same level of green, very minimal. The four states have not changed much. We did lose Louisiana. Went from dark orange to light orange. Same way with Massachusetts. In terms of comparisons, you can see there's been positive improvement in the moderate and the minimal range. We went backward in the low and the very high range. But again, something that indicates week over week how the country is changing, and what why this is important is this is a tracking of new activity. It's people who are presenting for the first time. And so this is a really important chart that as we come off social distancing, we're going to watch these numbers to make sure that they continue to be low for the state of Florida. One more chart that I thought might be of interest to you, and this is, again, it's the ILI chart, influenza-like symptoms, number of people who are presenting at hospital in a percentage category for anyone with ILI. And why this chart is sort of different is it tracks it over years so that you get a better comparison. So this yellow line here is the history over the last 25 to 49 years. The gray is the history over the last 5 to 24 years. And the orange is the period over the last 4 years. And two things that I think are important in looking at this chart. you can see that the 4-year chart sort of mimics the 5 to 24-year chart. So when you look at COVID, which is in here, and you compare it to the last 25 or 50 years, the trend line is not significantly different. It is accurate to say that the COVID impact is higher than what we've seen with influenza or previous coronaviruses over 25, over 50, over 75, or over 65 plus. That would include all of our historical data. The second thing that I think is important is to note that for the last 4 years, the trend line is overall higher. And so whether we've been dealing with SARS or MARS or COVID-19, those are the 3 coronaviruses, or whether we're dealing with just standard run-of-the-mill flu-like symptoms, overall, the last 4 or 5 years has been trending higher. Okay, we're back at the desk, and we're going to take a look at what's happening here at Regency Oaks and look at the numbers here. In the state of Florida, we're at 37,000 cases. It's up a little over 1,000 over the last 24 hours. The fatality rate climbed from 1,399 to 1,471. So we're under 100 deaths for the 24-hour period. Here in Pinellas County, the numbers look much better. We went from 784 to 788. That's an increase of only 4 cases in Pinellas County, and our death count climbed from 42 to 44. That's an increase of just 2. So Pinellas County had a good 24 hours, continues to support the decline of the curve. Pasco County is at 284 and 8 fatalities. They continue to be declining and holding steady on their mortality rate. And here in the United States, we're at 1,204,000 cases with 71,000 who have died. So that went up about 3,000 overnight. You probably heard President Trump say that he believes that those numbers are not an indicator of what we might expect in the future. He believes that those numbers are a result of reclassifications from other morbidities and data dumps that are being done by the health departments across the state as they process these tests and start to make proper reclassifications of morbidities. So we'll continue to watch this. Here in Pinellas County, we are at 236 hospitalizations. Yesterday it was 235, so only 1 new person in all of Pinellas County. More than 1 million people were admitted to the hospital yesterday with COVID-like symptoms, and in our zip code we are at 16, and we have been there for over 7 days. Here in Pinellas County, our testing, they did another 1,500 tests yesterday. We're now at 17,788 of those 17,000 have tested positive, and so that means our positive ratio, the number of people who have tested positive to the total number of people they have tested, is at 4.6%. That's dropped a couple of percentage points. We are still well below the 2% threshold that they're looking to establish for statistical modeling. Specifically, with our numbers at Regency Oaks, we are now tracking 14 residents, 8 in the IL, 6 over in skilled nursing. All of them are related to new move-ins or people who have gone to the hospital for non-COVID related symptoms and are returning to their apartment and are engaged in a self-imposed 14-day quarantine. We have tested one staff member for flu-like symptoms and have not heard back on those testing results. As always, we're completely transparent. We will share with you those results when we learn them. In terms of COVID-like symptoms across the campus, whether it's assisted living, skilled nursing, or IL, other than that one associate that has been tested and is at home, there are no other residents or staff member that we are tracking with fevers or other flu-like symptoms. We continue to have one resident in hospital who has tested positive. He continues to do well, and we are looking, the hospital is beginning to explore some discharge dates to get him back to his apartment here at Regency Oaks. He is in day 25 of his battle with COVID, and we continue to wish him well and see progress. There was one other thing I wanted to mention today. Rosa Heckman dropped me off a heart, and I understand a group of our residents has been making hearts that you can hang around your neck, and this is for today's parade. All of the staff on Wednesday at 2 does a parade. We call it the We Miss You Parade, and residents are showing their love back to the staff by wearing, displaying, and waving your heart. You can add an inspirational message or decorate it as you choose, but it's a great way for all of us to appreciate each other and recognize the sacrifices that are being made in order to keep all of us safe, and looking forward to a day when we can get back together. Talking about that, one of the things that I wanted to maybe share today and spend the rest of our time together is talking about how to keep safe as you go off campus. One of the things that we have noticed, the governor did lift the restrictions. We're in day 3 of phase 1, and people are going out and about. We have seen an increase in the number of people who are leaving campus and returning, and we want to make sure that you're practicing not only good social distancing, but the proper steps necessary to keep you safe if you are leaving campus, and before returning, are you practicing good personal hygiene? So I wanted to spend some time this morning talking and showing you some examples. From outside to Regency Oaks, you want to be sure to make sure your face mask is covering both your nose and your mouth. And as you approach the front doors, you want to make sure there's not any congestion. If you see congestion, whether you're going in any door, stand back a minute. Allow that congested area to clear before you try to make an entry or an approach. If you can find a door that is automatic, those are the doors you ought to use. You don't have to use your hands. Come on in. The first thing you'll want to do upon returning is to stop at the front desk and fill out the form. We are still tracking the fact that you have left the apartment. We're going to take your temperature. We'll ask the 4 questions. The more extensive report we are no longer doing. That extensive report had questions about where you might have been, who you saw, what was the purpose of you leaving campus. We don't need that additional information at this point, but you do need to check in with our front desk staff and have your temperature taken. Come on, we'll head this way. Okay, so I'm back in the community. I don't have my mask on. Remember a word about masks. Masks are primarily not to protect you, but to protect others. And so if you are showing symptoms, flu-like symptoms, you have a cough, or you are having a sneeze, that mask is designed to protect others. The reason masks do not protect you is when you put that mask on and you cover your nose and your mouth, your eyes are still exposed. And so masks don't do much good in terms of preventing infection to reaching you, but they are critical in making sure that you protect others. All right, let's head over to the restroom. We're going to practice some hand washing. Here's one of the things I see often. Don't do this. I see residents reach in, grab some Kleenexes, and open the door, and then put the Kleenex back in their pocket. That's not a good practice. Let me give you another alternative. Take your elbow, open the door, and come on into the men's room. All right, now Leslie has shared with all of you good, proper hand washing technique. It needs to be at least 20 seconds. It needs to be with hot water. It needs to be an aggressive approach, not just rinsing your hands and getting them wet, and making sure that you've gotten all areas, both on the top, the underneath, and the tips of your fingers. So we're just going to do a demonstration. You can go ahead and turn on the hot water. You want the hot water, it's more effective than the cold water. 4 essentials of hand washing. Hot water, aggressive action. It has the benefit of scrubbing and then rinsing contaminants away. That's why hand washing is so much more effective than sanitizing. Same way, you want to lather up really well. Now, you notice that I have touched both the soap container and the hot water. That is not a problem because I'm getting ready to wash my hands. So even if I have picked up an exposure, it doesn't present an additional risk. So you want to wet your hands, introduce the soap, and start a good scrubbing, primarily at this point, just to get everything lathered up and make sure that the disinfectant quality of the soap is beginning to work. Once you have that good leathering, the first place to start is the fingernail. And you want to rub your fingernails into the crooks of your fingers. You're getting all the contaminants underneath the fingers. Some people don't do that part. They wash the underside and top side of the hand, but it's not those surface where the contaminants live. It's actually underneath those fingers. And making sure that you get the tips of the fingers is critical. You continue, you can re-wet if you need a little bit more soap. The next step is to make sure that you get the webs of the fingers. Getting in between the webs, all the dark areas that are not exposed to sun, and get the contaminants. And once you feel like you've really gotten everything scrubbed down, it's time to start rinsing. Rinsing has a very proper technique. You want to start with your fingers up. And the reason for that is you are rinsing the contaminants that you've scrubbed out from underneath the fingertips. Once you actually have gotten that done, you then start rinsing from the top down to the bottom and let the contaminants get rinsed completely off of your hands. You can shake dry. Don't touch that knob yet. Grab a couple of paper towels. Thoroughly dry, getting in between the webs. Now, taking that paper towel, turn off your knob, and then head to the door. Without moving that, open the door, brace it, throw that away. That's why we put the trash can right next to the door, and you're done. Okay, so there's a little personal instruction on good hygiene. I hope you found it helpful. Everybody, as you start to go out and about and reintroduce yourself back into the world, be safe, take care of yourself, continue to follow good personal hygiene and safe distancing, and we'll see you Friday for our weekly town hall forum.